people in this presentation. Okay, good afternoon, everyone. Thanks a lot for joining today. It's a bit of a weird one because I can't see you, but you can see me. Also, you can see that unfortunately I didn't manage to change my background. So you're basically live in my beautiful living room. When I realized, or when I looked at the agenda last week, I realized that I actually got it really, really hard. It almost felt a little bit like a Champions League draw because I'm competing against 4 other clubs. So thanks for all of you who joined me today and actually made the decision to listen to me rather than Barcelona. It must have been a tough decision. Before I tell you anything about Upshot and what we're going to talk about today, I have 2 very simple short questions for all of you, really. And it is just for me to understand how much do you kind of know already about Upshot and what are the different words that come to your mind when you think about impact measurement. So we tested this a few times, so I'm quite confident it should work. So if you get out of your pocket your smartphone and you just put on your camera and scan this QR code, it should take you onto a tool which is called Mentimeter, which is, by the way, completely free, which is quite a nice tool. And I have 2 different questions for you. The first one is, have you ever heard of Upshot before? So obviously when you read about it, you heard about us, but have you heard about Upshot before last week? And then the second question, which will come up in a second, is just if you could share 3 different words that come to your mind when you think about impact measurement. In case your smartphone doesn't work, just type into any browser you have menti.com and then type in there this little code. I will now go out of this presentation for a second just to see what the results are. And how does that work? Let me have a look. So sorry for that. So let me see. Has anyone already answered that question? I hope. Oh, we're having. Okay, one person. Are there any people in this presentation today that have never heard of Upshot before or not quite sure? Oh yeah, 2. Don't be shy to answer that question. 3, that's very good. I will now go to the next question because obviously we don't want to spend too much time here, which is actually what comes to your mind. What words come to your mind when thinking about impact measurement? Okay, what do we have there? Obviously data, that's quite obvious. Time consuming, yeah, unfortunately, that's the way how loads of people perceive it. Indicators, yeah, that's very interesting. I think loads of these words we will cover during this presentation. So that's good to know. I will jump back into my PowerPoint now. And let's start. So what do we want to discuss today? So first of all, I want to give you an introduction into Upshot. We will discuss a few of the buzzwords that kind of fly around in the space of impact measurement. I will then take you, actually we changed a little bit the order. I will then take you into an outcomes framework, an EFDN outcomes framework. And then right in the end, I will show you or give you an idea of how you can develop possibly your own strategy. Just about Upshot. So why are we here? I don't know whether you've seen that on social media, on the website, in a newsletter, or you and your colleagues have already participated in the training, but Upshot is actually the new M&E partner of EFDN. So what does that mean? It means that EFDN is using Upshot for all of its programs. So yesterday when you listened to Martin and when he discussed and presented the Community Champions League, or earlier today when we listened to Scoring for Health. EFDN will be using Upshot to measure the success of this program. So the idea is that all clubs that take part in any of these programs will be using Upshot. What did we do? So over the summer, when I was luckily on paternity leave, two of my colleagues have worked really, really hard with EFDN and all the member clubs to implement Upshot. The idea is obviously that in the future, basically the whole EFDN membership will be using Upshot. So no worries, I will not go into the system itself. So if you want to see a little bit more of the system, please feel free to get in touch. Today, Hubert from EFDN asked me also ask us to discuss a little bit MEL terminology and why it's really important to EFDN, and really kind of to run through some of the buzzwords. So let's go. A little bit about Upshot. So believe it or not, I actually work for a charity myself, like I reckon most of you do. So Upshot is actually part of the Football Foundation. For the people of you who are not from the UK, you might not know the Football Foundation. So the Football Foundation is UK's largest sports charity. What we do as an organization nowadays is we build infrastructure. We build football pitches, we build changing rooms, we build floodlights, we build toilets, etc., to essentially increase participation in sport, or more particular in football. Our annual budget is roughly £60 million a year, and we get our money from the Premier League, from the Football Association, and the government through Sport England. The reason why I'm telling you this, it's not always been like that. So actually, until roughly 10 years ago, a little bit less, 1/3 of the money we invested went to community projects. So football clubs like yourselves or any charities that were running projects related to football could apply for a grant from the Football Foundation. And at the time, we as an organization realized that we had massive problems to understand the impact we achieved with the funding we were giving out to all these different organizations. And that's when we realized that we needed something different. We needed a tool that would help us as a funder to understand our impact, but more importantly, to have a tool that would help our grant recipients to measure and collect the data that we were asking them for. So that's when the idea was born. Upshot was created in 2012. We have now more than 850 non-profit organizations across the world using the system. And what is important to say is that even though we come from football, it's actually 50-50, 50% are sport, 50% are non-sport. So we work with loads of local governments, housing associations, YMCAs, universities, charities in any shape or form, from environmental to employment, etc. What else is there to say? We work across 5 continents. Upshot is available in 4 different languages and is actually fairly easy to translate into different languages. Very quickly, what does Upshot actually do? It helps organizations to manage their data collection. And you can see here some of the examples. To monitor their performance. Obviously, the word we saw earlier, key performance indicators, etc. And then to evidence their impact. As I said earlier, if you want to see the system, just get in touch after this presentation. But what I want to emphasize here is that it's not just about quantitative data, it's also about qualitative data. You see here, and we are incredibly proud of these beautiful designs, but these are basically some of the different features that are available on the system. Who do we work with? So you see here a number of sport for development organizations we work with. Obviously, we work with a lot more than that, but these are just kind of some of our examples. And it's important to understand that all of them really use it for a number of different programs, such as employability, inclusion, youth work, volunteering, participation, etc. Now that's it with Upshot. Now let's go into a little bit the more complicated things. One thing which I want to mention here, I'm not an academic. I'm not claiming that any of the definitions I'm going to present are by any means perfect, but the way I will explain it is basically how I explain it to organizations and we are working with. And another thing I want to mention is we will discuss, for example, the theory of change as well. And Pat, I don't know whether you have, I certainly have attended workshops for multiple days to cover these really theoretical terms. So today we will really kind of just touch the surface really and go through it in a fairly speedy way. Anyway, let's look at impact and measurement. So what is actually impact? Impact is a positive intended impact. Obviously, there's lots of negative impact as well, but we as organizations, we obviously want to achieve positive impact. So let's look at an example such as scoring for health. So what's a positive intended impact? Participants improve their health and physical conditions. Meaningful and important. So it's really about trying to change a recognized problem. So if we look at scoring for health, that might be diabetes or obesity, overweight, whatever it might be. Another definition or another thing that explains impact, it has to be sustained. It has to be a lasting effect. I'm sure that some of you know that problem as well of the yo-yo effect. You lose weight, you gain weight, you lose weight, you gain weight, etc. But the idea of impact is that it's long lasting. And then the last thing, achieved by individuals and communities. This is really important because very often when I speak to organizations, they say we, I, but essentially as a charity or as an organization, we try to show people the way, but they still need to walk through that door themselves so they achieve the impact, not us. So they lose weight or they become healthier, they increase their awareness for a better nutrition. So let's look at measurement. It's fairly similar in a way, but again, long term, I need to measure my results long term. If I just go and if we think about the yo-yo effect, if I just go and say, okay, great, you lost 2 kilograms, and that's it, and I say, great, it's been successful, that doesn't mean anything because I have to look at it multiple times. I have to look at it over time. It has to be comparative. So who made the difference, and also kind of what's my baseline? Where do I come from? Is 5% successful? Is 10% successful? Is 2 kilograms successful? And then it has to be robust. It has my data needs to meet standards. It has to be a thorough data collection. So this is the definition in our eyes of impact measurement. Now, what is monitoring, evaluation, and learning? It's fairly simple. It's 3 different questions. What are we doing? What have we achieved? And what can we learn from it? I reckon this actually makes sense. But then when you look at the graphic on the right-hand side, you will see it actually looks slightly different. What is important to understand here, it's a circle. It's a continuous thing. It's something that has to be done continuously. It's not a one-way system. You have to review what you do. You have to learn and analyze it. You have to adapt as you go along. You have to define what you're trying to achieve. You have to test your assumptions. You have to analyze feedback and your data. And if it's working, you replicate and scale it. And if it's not working, you might need to tweak and adapt it in real time. You have to do it the whole time to improve your delivery and your interventions. And the other thing you can see is under A is define. I think very often it's a common mistake in the monitoring evaluation world is that organizations kind of look at it right at the end after 2 years. They analyze data, and then they realize, oh, that's a shame. We actually didn't achieve what we wanted. So what is really important is that you also embed it from the very beginning, that you think about what data can you actually collect. Can you get the buy-in from your stakeholders? Can you get the buy-in from your employees? Really, it has to be embedded right from the beginning. Ideally, even as part of the grant application. Now, let's look at some of these buzzwords. Also, when we looked at this Mentimeter right in the beginning, some of these terms came up. I'll put it very simply here. Input. I start at the bottom. Input is actually the resource or an organization or an individual actually invests. So let's look at the presentation today. So what's the input? The input is actually my time. Believe it or not, I spent quite a few hours to kind of create this incredibly beautiful slides and really to think about what I'm going to talk to you about. I went through previous presentations. I thought about good examples. I rehearsed it with colleagues. So this time I spent is my input. What's the activity? So the activity, welcome, you're part of my activity essentially. I preach to you today about the importance of M&E. So this is my activity, it's my intervention, it's my workshop. Outputs. So what's the output? I don't exactly know how many of you are listening to me, but I hope it's hundreds. So it's hundreds of you are listening to me. I hope that 60% of you will give feedback to EFDN about my presentation. Perhaps 25 of you will download the presentation. So all of these are outputs that I'm expecting. What's the outcome? Fingers crossed. I hope that after my presentation, you have a bit of a better understanding of M&E and impact measurement. You improved your knowledge. So your improved knowledge is my desired outcome. And then what's the impact? The impact is that because you learned new things, you might be better at your job. You might be better in designing programs. You might be better in M&E. Or you might realize today that that's actually not the career you want to pursue because it sounds very boring. All of this can be an impact. Now it becomes really scary. I think not just for you, but also for me. So we see here two kind of big buzzwords: theory of change, log frame, or logical framework. What is really important to mention here is that there is no right or wrong model. There are just different ways to approach similar challenges or to change a social problem. So what's the theory of change? The theory of change looks at the big picture. It summarizes from a strategic level. It takes assumptions into charge. So for example, you see here at the left, institutions foster gender equality to achieve the change of women becoming more economically independent. It looks at different stakeholders at the time. So I can look at the family, it can look at institutions, at charities, at the workplace, and loads of different stakeholders which are involved. It looks at policy and regulation. So how can they impact the change that I'm trying to achieve? And actually it shows really different pathways to achieve change. And these different pathways might be very unrelated. And it can look a little bit like an artwork. I think the left one is okay. If I had painted or drawn, it would have been a lot uglier. What's a logical framework? So a logical framework is, it illustrates more like just a program, or it's just an implementation level. It's logical and sequential. It's very neat, clean, and tidy. You say, if I do X, then it leads to Y. It just looks really at components that are part of my program. It's very linear. where it says this activity leads to this output leads to this outcome, just what we kind of discussed before. So the theory of change is a lot more of a comprehensive description. It's an illustration of how and why a desired change is expected to happen in a particular context. But at the end of the day, all these different concepts come down to the same thing. Where are you now? Where are you trying to get to, and how will you get there? This is a small illustration I found online, which I thought was actually quite interesting. It's a theory of change. How can I get to work on time? And you see here, there are loads of different ways how to get there. I could just leave the house earlier and that's it. But it could be also that I go to bed earlier, therefore I wake up earlier, and then I take a different route to work. So you see here, this is just a nice little example that there are loads of different ways of how you can get basically to where you want to get to. So now I will take you through kind of an outcomes framework and taking EFDN as an example. So that's something we developed ourselves. And what we do here now, we look at what's the kind of, and I'm just making this up a little bit, but what's the overall impact EFDN might want to achieve? It is improve 1 million people's lives. So how do I get there? I can look at my own organizational outcomes, and these are actually real outcomes that are part of the EFDN strategy. Can then say, how are these organizational outcomes linked to global outcomes? So global outcomes in this case, and I look in particular at the health project, how are these organizational outcomes linked to UEFA's outcomes, European Union's outcomes, and even to the Sustainable Development Goal outcomes? Then in the next instance, I say, okay, great. I know exactly what I'm trying to achieve. What's the overall outcome I want to get to? What are the outcomes that I need to achieve as part of my funding agreement? And what are my organizational outcomes? So now you see here, these are a number of different programs obviously EFDN is working on or running. And we will look into a little bit more detail on the scoring for health. So below the scoring for health program, you see a number of different activities that I'm delivering or that EFDN is delivering. Some of you might be delivering. So how are they then linked? So how can I say that scoring for health has achieved some of its outcomes? So I can look at different KPIs, so number of workshops delivered. What's the measurement tool on Upshot? Session registers or headcounts. Or I want to engage at least 120 participants. Again, in Upshot terms, I look at the registration form and then how many of them have attended certain sessions, or how many people have recorded a weight loss. I look at a participant journey. I can measure BMI, I can measure weight losses, etc. Or I can say how many website, and all of these, by the way, are real examples. So I think for the people of you, oh, that was terrible English, I'm afraid. For the ones of you who work on this program, you will be aware of all these KPIs. But the idea here really is to then look at all the different tools that are available on Upshot, how they help EFDN to measure and look at the different key performance indicators. How are they linked to the scoring for health program? And then how they are linked to outcomes and to the wider outcomes. I hope that that makes sense. I'm more than happy to run you through this in a lot more detail another time. So now let's come to, so why is it important for EFDN? Why is MEL so important? Obviously, there are these kind of different buzzwords here on the right-hand side, such as greater transparency, improved project performance, effective resource allocation, etc. But here on the left-hand side, it's for EFDN. They receive a lot of money from the European Union, and they need to have a system in place where everything where they can measure the impact across all programs and clubs in one place. There needs to be a consistent data collection. It has to be real time. It's really important to react, to see what's going well and what's not going well. Being able to report back to funders easily rather than spending weeks at the end of a funding circle to analyze and understand the data. Also to really demonstrate impact to shape policy. It's so important to show the importance of football. People always look at football just as this kind of elite sport, but football does so much more than that. It's important to motivate and encourage clubs to capture evidence. It's important for them to see the amazing things they've achieved over time. And it really helps this kind of consistent learning and evaluation of programs. What can we do better next time around? How can we design perhaps a different program that helps us to tackle other social problems? I hope that all of this makes sense. Unfortunately, I can't see you nodding or shaking your heads. And now, right in the end, and we're already at the end of the presentation, really, this is, it's like, what can we do really? Apologies, I will quickly. So what are the different things that I need to look at to develop my monitoring evaluation strategy? So I look at my current position. Where are we? What can we do? Who are our stakeholders? What is it that we are working on? How can I then set goals? What are my objectives? Think about not just about outputs, but also about outcomes. Then analyze what all the data you already have. Think about how you can use it and how you can make it better. Collaborate with different organizations, with different partners, with schools, as we've already seen. Use this data and use what you discussed together to set common goals. Monitor and measure and evidence what you have. Review it on a consistent basis, and then most importantly, really communicate the mistakes, and obviously communicate the successes of your program. I appreciate that's been a fairly quick run through a lot of different terminology, and I really hope that it has helped a little bit. I'm now here to take any questions from anyone. So please, Louise, it's over to you. What would be also interesting if you could put into the chat box some of the biggest obstacles you have in your organization for consistent impact measurement. Now over to you guys. There's a chat. Oh, okay. So what's the question, Doris? Said they, yeah. So you already use Upshot for scoring for health. I know that. So we obviously have implemented this over the summer. Views, I try not to use the word, but as some of you know, that's obviously the tool that EFDN used previously. And for whatever reasons, really, they made the decision to go with Upshot. I'm fairly confident that's been a good decision. Are there any other questions or remarks? Louise. Otherwise, feel free to get in touch with me or anyone within the Upshot team. I'm more than happy to share the presentation, to arrange a call. So yeah, then thanks a lot. I hope it was useful. I wish everyone a good lunch break, I assume now. And I speak to you soon. Bye-bye. Or shall I stay here for a little bit longer? So I'm really sorry. I know I'm getting onto proper slippery ground here. How do you pronounce your name? Ploin Brugsteg said, so your biggest obstacle is to find the perfect statistics, the comparison. So what do you mean by that? Is it basically to see what's the baseline, or is it to be able to get the right data out of your basically out of the right statistical report out of the data you've inputted? It's a shame that I can't hear what anyone else is saying here. I can see my colleague WhatsApping me a different question, but the question hasn't come through. Lynn. Means the right data. Would you mind? I think I will send you a quick message through the EFDN platform, and then perhaps you can discuss this further, because I'm not 100% sure what you mean by that, Plern. And I think it's just easier if we talk, because yeah, obviously it will be really useful to talk to you about it and to hear a little bit more. Oh, is Upshot for free? Good question. So no, Upshot is not for free. We obviously have a kind of an agreement with EFDN. I don't know the organization you're working for. So if you work for one of the membership clubs, there's obviously, and you will be part of one of the current or future programs, then it will be free, or whatever way EFDN kind of decided to kind of to take from members. Otherwise, it is not for free. It's very quickly, there's a license fee and a consultancy fee. The consultancy fees helps organizations to implement the system, do the training, etc. And the license fee is basically a fee that allows you to use the system. But yeah, I think that's probably something we could discuss outside this presentation. Okay, thanks a lot for listening today, and I wish everyone a really nice, good lunch break and a good remaining conference. Thank you very much.